1, and we're live. TikTok live number 52 now. Here we go. What's going on, everyone? Guys, by the way, the top 5 listeners to the chat, to the podcast right now on TikTok live, I'm going to be giving you guys a shout out in the caption on YouTube and podcast. All right. Darius Neibati joined and asked, how was your day? What cases did you work on? So we were pre-op for a big cancer case, bilateral neck dissections, glossectomy, and mandible, but it was canceled due to some circumstances. That is going to be postponed. Trevor4792 said, you do x-rays? I can do x-rays. Usually I help out with the PAs, but usually dental assistants help out with Panorex's PAs and stuff. So it's usually like a mix, whoever. Anyone could be doing. Panorex's I haven't done in a long time. I usually just help out with PAs, kind of getting it positioned, right? Because you only want to take it once, especially on like a kid, for example. That's usually what's been going on. What's going on? Where's the next? Taylor Aronson joined. What's going on? What's going on, Taylor? Trevor just got the #1 gift badge. Thanks, Trevor. Elle said, finally done with the CBSE, doc. Should I come to NYU for an externship? Elle, what's up, man? Congrats that you got the CBSE out of the way. That's excellent. Yeah, you could do externships anywhere. You could go to NYU. You could go to places. Do externships at reach programs, like programs you don't anticipate getting an interview at or getting into, because it only works in your favor. If you have a really good externship, they're probably going to give you the interview, right? If the externship doesn't go so hot and you don't really vibe with the attendings and the residents of the program, well, you didn't expect to get an interview there anyway. So you see what I'm saying? Reach schools or residency programs are what I'm talking about. Extern at residency programs that are going to make your CV, your application look stronger, right? Because you did that. Like, you know what I'm talking about. Santa Cruz Medicinal said, thoughts on cosmetic jaw implants. What are my thoughts on it? Yeah, you could go and do it. My one thing is like, why I prefer people to try and like work on being comfortable with their own bodies rather than trying to morph into something that they're not. You see a lot of these teenage girls trying to have the Kim Kardashian this, Kim Kardashian that, the Kardashian this and that. And I just don't think that's healthy. That's going to build a self-esteem that's always chasing the next thing. That's always uncomfortable with something about themselves. And I don't know, I miss the old shows, the old movies that were very empowering for us to kind of recognize our own talents and skills and really kind of hone in on bringing the best out in that and building and working on that. Just my thoughts. Luke, incoming D1, changing up the scrub color. Yeah. This has got like a stain over here, something. I don't know why. But yeah, these are the private hospital scrubs for nurses, and one of the nurses gave these to me, and they're super comfortable. They're like really cozy. Yeah, I like them. I like the color too. I get a lot of compliments on these ones too. I don't get compliments on the scrubs as much. Yeah, that's funny, right? Elle said, would you take an externship at a program you have no interest in going to? If it's a good name program, yeah, then I would do that. If I have no interest in going there, and like, what value is that going to add to you? Do you want to just do an externship there for that experience? Yeah, sure, then why not? Kate said, what specialty would you choose other than OMFS? It's not a specialty, but probably just general dentistry. I would probably go with that. Elle said, I know people say programs like Parkland look good, but I don't know to do that or programs I'm interested in. Yeah, I would extern. Dude, what is your Elle? Tell me what your gut feeling is telling you, because I would extern at programs that I'm interested in going to, but that I wouldn't expect to get an interview at. Darius Niabati said, goes well with your hair and complexion. Thank you. Jay said, hey doc, what's up, Jay? Kyle said, what was the scrub brand? Oh, these are just these are just scrub machine brands. See, it's got like the hospital band in the back. I have no idea what the scrub brand is. 344. What are stereotypes about OMFS surgeons? Some of the stereotypes are they like to ask you a lot of questions on the procedure before you go into it. Let's see what else. What other things I heard, that they're always so tall and like buffed, big meaty guys. And then I know plenty of really short surgeons. I know a lot of women surgeons too. So it's not like it's like a stereotype. It's like a fake. But what else? Very, very brainiac, nerdy. The oral surgeons, yeah. Chango 69_420. What's your hair routine? Trying to be like you, my boy. My hair routine? I wash my hair maybe once a week with soap, with like shampoo and conditioner. That's what I mean. I wash my hair every day. sometimes more than once a day. But I only use conditioner, shampoo and conditioner like once a week-ish, right around there. And no, in the mornings, just wet it down, dry it off, and then I put the product in, and then I blow dry it. I use the blow dryer, and I use like one of the calm things. DB said, what's your opinion on best ways to study? I think the best way to study is, number one, you got to eliminate those distractions. You really got to get your phone the heck away. I used to keep my phone in the car, and then I would go into Panera and study there. My phone wasn't connected via iMessage. It wasn't. So I would keep everything separate. Number two, I would think about getting some music that really stimulates your mind to learning and absorbing information. For me, that was progressive house mixes by The Grand Sound. You can find them on YouTube or Spotify for less ads. And then three, noise canceling headphones. The AirPods that have noise canceling, I found that to be excellent. So going to Panera, you're in like kind of like a busy environment. People are passing by, talking maybe, but they're not distracting you. You just kind of like feel that there's activity around you. And noise canceling headphones, so you can't get distracted by that, and then keep the phone in the car so you're not distracted by that. Yep. Oh yeah. Ian said, what do you think about Sinai's program? I think Sinai's a good program. I think Sinai's, they're like right up the street from us. I think it's a good program. I do know that they have multiple facilities that they're covering now, right? So Jay said, should I include being a DJ in dental school application, worried about AdCom seeing it as a negative? I don't know if it's a negative. I mean, what did you DJ for? Was it like frat parties? Was it like events? Was it like, you know what I mean? You could spin this into being, it could be a really good cause, not just like frat parties. But I actually did include a bit on music on my application, playing the violin, music producing. Yeah, a little bit. See, Benji, what's going on, my man? What's going on, Z Benji? How we doing? 73 said, hi, Brendan. Hey, Cali Girl 73. 69_420 noted. All right. 344. Should I get my genioplasty plate and screws removed if I can feel them, or is that normal? Well, I didn't put them in, so I can't tell you exactly what to expect, right? I haven't seen your x-rays. I haven't seen your soft tissue, how thick, how thin it is. I haven't seen your bone structure. I wouldn't be able to tell you that because in a lot of these situations, it's personalized to you. You know what I mean? Darius Niabati, what's the best thing you got to do today that helped another clinician? I mean, we're planning cases out. We got a case going Friday, big one, orthognathics. We got another one in 2 or 3 weeks on a Friday. What's something I did today? I put in discharge instructions and orders that generally, historically in our program, seniors do that. Whoever's holding the pager, seniors, affiliates, and interns. And the chief resident kind of supervises and directs, but doesn't put those in. So I put them in, and I'm the chief, but it is what it is. They were busy running a clinic, and so I tried to help out by getting things going, User 0987, complicated nail laceration thrown through in the ER today. Rick's on how to suture well. Well, so, what you said in the nair, and so the nose. Well, I mean, it depends on patient compliance. It depends on, you said through and through, but in the nose, that could mean more or less one or two things. So, I mean, generally on superficial lacerations in cosmetic areas, I really try and get a 6.0 Prolene or 6.0 nylon to suture that close. I just did a laceration repair last Friday, actually. Not a laceration repair, but it was in the surgery. And I used 6.0 nylons. It takes a long time, but if you do it right, it has an excellent result. And, especially in cosmetic places, I think people appreciate that. And I think it looks better. So Ash Arnold said, how do you deal with stress or just hard moments? Well, I take a step back. I think about, that whatever that situation is in the broader scheme of things. Depending on what it is, maybe I try and slow down my breathing and kind of really try and be relaxed rather than get overheated. Lately in quick conflicts, not conflicts necessarily, socially, sometimes I just pause and don't say anything. That's been another thing that I've been doing the last couple of years, is just not necessarily responding at all, which is an interesting take. But, if someone's saying or doing something to provoke a reaction out of you and you don't deliver it, then, you kind of keep things in your mojo. But Congo 69_420, has there been a procedure you just hate doing as an OMF? I don't know of a procedure that I don't like doing. Yeah, we'll see. I mean, going to the OR can get really tedious. And then it's like, another thing is in clinic. I mean, you could see 15, 20, 30 patients a day, but in the OR, you're not seeing 30 OR patients. You know what I mean? You're not doing 30 surgeries in the OR. Things take a lot more time. There's a lot more things involved. And I don't know, the speed of oral surgery in a clinic setting, I find to be very stimulating. And you get to see more people. You get to help more people out. Erwin Vasquez, okay. Kirsten, okay. Has there already been a procedure you don't like? Good. Catherine Vo. What's up, Catherine Vo? Darius Neibati. Oh, thanks. Thanks for reporting. Erwin Vasquez, sure, doing that in the chat. C. Benji, thoughts on University of Utah's program? They came to our university today, and it seems great. Oh, well, that's good. I'm not familiar with University of Utah's program. They seem to be very kind of to themselves over there in Utah. And why do I say that? Because on our pre-dent mentor map, we've had some history with Utah having difficulty getting mentors from their program. And then that being said, there's someone who just messaged me, really nice dude at University of Utah, who helped us out with some of the stats there. And he's, so what I'm saying is, like, they're really great people there too, which is awesome. It seems to be a good school from what I can see from afar, but the pre-dent mentor map has some more information on there. Apple Pie 56, you're so attractive. Darius Niabati said, don't engage with the hate. Love it, Darius. My guardian angel over here. Amulya said, are you Mormon? I am not Mormon. Amulya said, Darius Niabati, are you Mormon? Amulya liked the live. Thanks, Amulya. Awesome. M. Jones joined. Darius Niabati said, I'm a Buddhist. Amulya liked the live. What's going on? Where did you go to dental school? Asked Amulya. I went to Stony Brook Dental School. It's a small dental school out on Long Island. It's like one of the 3 or 4 smallest dental schools in the United States. They had 44 in my class. I think they're at like 46 to 48 students a class. Did I like it? Yeah. I mean, did I like it is one thing. Did I like the location? I did like that location. It was like 15, 20 minutes from my hometown, my house, actually, where I grew up. So like 10 minutes from there. But yeah, I like the area out there on Long Island. It's on the North Shore, a historical area, great running areas, the streets to run on, streets to bike on. The small school can be tough at times because you're either going to click really well with like big groups in your class, or sometimes not. And that can be pretty difficult. You know what I mean? So Chango 69_520. I notice your eyes are sort of patchy. I'm working with a resident, has the same, says he doesn't see it. Huh? Maybe. I don't know. I've had these rings around my eyes for a long, long time. I don't think they'll ever go away. And so I'm not going to try and get surgery to fix it. I'm just going to try and move forward. Hangry hedgehog. Hangry hedgehog. Know anything about Boston Medical Center / BU OMFS externing there soon? Yeah, BU, the word on the street when I was applying, now going back 5-6 years, that the culture there was not so great. Okay, that's something that I had heard on my externship trail. Okay, so I don't know. I didn't extern there. I didn't interview there. So I have no idea. But this is what I had heard from people. Okay, and I'm not trying to perpetuate a false thing because this is from 4 or 5 years ago. I have no idea about that now. Externing there soon. But yeah, look, dude, so you're going to be externing there soon. So you'll be able to get a better idea than I have right now, you know? User 098765. Is your program a bridge with a medical school? Stony Brook was a bridge with a medical school. Our oral surgery program, yeah, it takes place in a hospital setting, yeah. JH.B58. Any recommendations or tips for dental school and the DAT? How many hours did you study? Well, for the DAT, I mean, I studied about a month and a half for that. Could take longer, you know, if I had to retake that. But yeah, a long time, like every day, like 10 hours a day, 10 to 12 hours a day, maybe more, 10 to 15 hours a day for a month and a half. That's how much I studied for the DAT. Tips? I mean, just study. Just get good with either Anki or Quizlet cards. That's what I found helped me in dental school. Amulya, why did you decide to go? Decide to go to dental school? Because I felt that the dentist that I knew at the time I had shadowed, my mentors, had a better lifestyle than the doctors that I had shadowed and mentored. And they were both helping people. I'd rather be happy with my life and be able to do something I love rather than not with anything, right? Luke Meek said, how is dental school in Puerto Rico? I don't know. I haven't been there. Ash Arnold said, what's your healthy lifestyle? I mean, gosh, today was the healthiest lifestyle. I didn't get to exercise, and that's my fault. I was doing a lot of work with like computer stuff, content, meetings, doing work for the residency. I don't know. I just got caught and I didn't get around to do it. I looked up and it was 8:19, and after 8 o'clock, I don't like to work out because then it really kind of like compounds and it pushes back going to bed and then getting up the next day. It's just not worth it for me that I found, as long as I could stick to the schedule after that. Amulya said, where did you go to undergrad? I did 2 years at NYU Polytechnic School of Engineering. That is now NYU Tandon School of Engineering. And then I did my latter 2 years at Stevens Institute of Technology. So I graduated from Stevens. That's in Hoboken, New Jersey. Hudson just got the number 2 gifter badge. What do you think of someone getting into dental? Emily said, do you think someone could get into dental school with a 3.3 GPA? I do know people that got into dental school with a 3.3 GPA, actually. Luke, incoming D1, said, did you mention OS experience summer before dental school in your residency application? I did because I worked for an oral surgeon as a surgical assistant, and that was like already embedded in my shoot. There we go. That was already like embedded in my application. If that makes sense. There we go. User 2946, do you dental dam the downstairs? AV said, is NYU dental school worth it? Well, what do you mean worth it? Like to get a degree as a dentist or like the tuition? NYU is a very expensive tuition. I don't know though. I also didn't go to NYU dental school. Tyler L said, got into private school, $450,000 for tuition, or reapply to try and get into state school. Any advice? What's the private school? And what state schools would you be interested in doing? So what school is it? What are you trying to do? Is it an expensive private school that matches a lot of students in specialties? That's something to consider. User 09876, come to Florida when you're done with residency, brother. I have family down there too. I've given it a thought. I just signed a 2-year contract for up in New York on Long Island, but hey, we'll see. We'll see what the future holds, you know? Amulya said too expensive. Florida's not too expensive. New York is a lot more. No. Amulya is saying the dental school. That is very expensive, but that's not per year. You're talking about all 4 years, right? I want to know which school you're talking about, though. You know what I mean? Blake Miller, currently in PA school. Do you have any PAs in your practice? What is their role in procedures? We do have a PA in the program, and she's awesome. She's a big help, really nice. And she helps with sometimes holding the pager, sometimes seeing consults, follow-ups, and assisting in the OR. Yeah. But not in my practice. I'm not out in practice yet. Matthew, did you go to La Costa Canyon? I don't know what that is. Amulya and Nebular Molars. It's Remy. Why dental and not medical school? Well, personally for me, when I shadowed and observed the dentists and the doctors in the outpatient clinic, actually I shadowed the doctor in the hospital too. He was awesome at everything, but overall the lifestyle seemed to be better. And the dentists and oral surgeon that I worked for and shadowed generally seemed to be a lot happier and a lot more, I don't know. I connected with them. I really connected with them, and the lifestyle seemed better. You know, they're both helping patients. The oral surgeon was doing surgery, and the dentist seemed to be happier at the end of the day. I want to be happy too. Paul Hoyen, how do you feel about studying for the CBSE the year before dental school, non-med based curriculum? I don't feel very enthusiastic about you doing that. I just don't think it's worth it. I really think you should just travel, spend time with friends and family that you don't get to see. Do something in your gap year or before dental school that you've always dreamed of doing and weren't able to do it. Remember, you might not get that time back to do that thereafter. So do it now. That's my recommendation. That's what I would suggest. Hangry Hedgehogs at Blake Miller, dental practices don't hire PAs. Also, he's in residency, correct? I don't know. I don't know of any practices that have PAs in the dental practice. I don't know of any, but I don't want to say none. You know what I mean? But yeah, that is correct as far as residency. Amulya, Paul Hines, it's too early to take it then. User 294610, Brendan answer. Amulya said, no, why did you decide to go to Stony Brook? Oh, Stony Brook, because it's a smaller school, dental school, gets great clinical attention, which it definitely did. Small schools also generally, from all the smaller schools that I know, that all generally place higher numbers into specialties. And it did prove true for my year. And for me, I got into oral surgery residency coming out of Stony Brook. My hunch was correct. It worked. And that's why on the pre-dent mentor map, we're adding all the specialty matches for this year on there, because it'd be a really good idea if pre-dental students could get an idea, what the history is of that dental school placing in specialties, if they might be interested in, that's important. Jay Adams, 143, had a molar removed on Friday, hurts more today than all weekend. Yeah. So Friday, Saturday, Sunday, and Monday, that's days 2 and 3. Also, day 3, you might have a dry socket. I would definitely should follow up with your dentist that removed that tooth then, Well, I just opened up a can of worms. Where is Amulya is saying hedgehog in all caps. That's hilarious. That's really funny. Amulya, oh my God, you have so many questions. There's a fight going on in the chat right now. This is funny. JH.5, B58, how many hours a day did you study on average in dental school? In dental school, on top of classes, I would say after classes, still a couple, I would say anywhere between 2 to 8 hours on top of dental school. Yes, that's true. Luke, at Hangry Hedgehog, keeping my options open. Paul Honey said, at Amulya, studying doesn't equal taking it. Hangry Hedgehog, Luke, as you should be, yada, yada. Hudson said, but considering specializing, do you think GP dentists are equipped to do implants / IV sedation? Well, no. You can't do IV sedation as a general dentist. No, you can't do that. Implants, there single implants and simple implant cases that general dentists can do. Absolutely. The thing is now, it seems like all general dentists want to do is extract teeth and put in implants. It's the most lucrative financially procedure to do. And I don't know if that makes it right though, but there's also from the dentist perspective with the amount of loans and keeping a practice up and the lack of reimbursement from implant companies, insurance companies, we're at a really crucial turning point in dental, the history of dental care in the United States. And I don't know. It's kind of concerning the way we're going, because it's just like patients can't afford treatment, insurance, so they get insurance. Insurance doesn't pay for treatment, so the dentists don't get money for the treatment they already did. It's just a spiraling downhill battle. I don't know. Drizzy Burner said, any advice? Really in a slump, confused, did well in undergrad and DAT, but struggling in dental school. Well, you know what I would do is I would suggest trying out. I used to, through most of dental school, I used to write down on an agenda everything I had to do every single day. And then I found this app called Microsoft To Do, and it's like a to-do list. It's a calendar. It's a scheduler. You could divide up things into folders to organize them. And now I have things that repeat every day, every week, every month. And I organize them every single day based on priority. And then I just knock them off one by one. And by the end of the day, in fact, I got to get going. I got to take a look at today's list, whatever I still got on it. But that's what I do. It helps me combat anxiety and helps me crush my day. And I want you to crush your day too. Try it out. Let me know what you think. Amulya said, come to Texas. Yeah, I got to get down to Texas. I like Texas. I liked Austin. Darius Niabati said, when can we expect the stats for Texas schools? Yeah, okay. I think I put up Texas Tech. I think we got that one up. I think Sean implemented that to the website. The other schools I haven't heard anyone back from yet, but I think it's Texas Tech that we got, right? Tyler_Beck said, I just got accepted at dental school. Any advice going into this? Yeah, enjoy as much time as you can before you start dental school. Enjoy that time now to do something, travel a little bit, go on vacation, do something new, read a book. Spend that time now doing what you want to do. I'm serious. JH_B58. What do you think about the University of Florida for dental school? Yeah, UF is a good dental school from what I know. I didn't go there, and then look on the pre-net mentor map. UF generally is a good school. J Adams 143 had a molar extracted on Friday. Oh yeah, that's what we're talking about. 3 days later, you might have a dry socket. Otherwise, we're also day 2 to 3. Swelling's at a maximum. So yesterday and today, I would suspect you have, that would be normal to have some added pain right now. Amulya said, how old are you? I'm 30. Getting old. Amulya said, where is the residency? The residency is in Manhattan, New York. Yeah. Jesse, you said, most stressful part of your journey. The most stressful part, I would say starting dental school was stressful. The beginning of residency was stressful. Through the middle of residency was stressful. And the off-service rotations could get stressful sometimes. Yeah, that we do during residency. Hangry Hedgehog said, come to the live prepared. And Amulya said, at Hangry Hedgehog, how do you know this hedgehog? What is going on over there? Jay said, what fellowships do OMFS have? Do you need the MD to pursue them? No, you don't need the MD to pursue them, although sometimes they can be considered beneficial, and helpful to applying to fellowships. What fellowships, though? I mean, there are different cosmetic fellowships. You could go into an additional orthognathic surgery fellowship. You could do BBLs, Brazilian butt lifts. You could do breast implants, tummy tucks. I know an oral surgeon that wanted to do that. I know you could do head and neck oncology. You could do head and neck surgery fellowships. Yeah, so those are some of the things. Morad Khannan said, I'm graduating soon. And, oh, shoot. Wow. Why does it do that? Oh, man, here we go. Morad Khannan, I'm graduating soon, applying to jobs currently. Any recommendations for applying to jobs? Yeah, go to the offices and contact them. Like, I would go to the office and talk to them in person. Like, get to know them, and you'd learn a lot from going there. Darius Neibati said, what would you tell D1 Brennan stop worrying about and focus more on? I don't know, man. D1 year actually mentioned that, Darius. The girlfriend at the time had broken up with me in October of D1 year. And then that really messed with me. We were dating over 2 years at that point. It was going, it totally caught me off guard. And I would say D1 year, especially right after that, I was concerned. I was like, I don't know, it just, self-doubt, a lot of questioning, are you going to be in a relationship again? How are you going to do that? I wasn't worried about that. It was more just like, I don't know, I didn't see it coming. And I was starting a new time in my life that was stressful, and I wanted to have that foundation going into it, and I didn't anymore. It was, it took a while for me to bounce back after that, this many days, but eventually did. And here we are. Hangry Hedgehog, Amulya, because he's a fourth-year resident, so he's probably 29, 30. Do the math. Micah said, chill out, bro. My girl is on here. S said, tips on how to survive undergrad. Yep. Just study. Don't get caught up in the masses. Make sure you point the direction of your career towards the direction you want to go, ultimately. I know that's very basic and general, but that's what you want to do. Mored Khan said, recommend GPR. GPR is a good idea, especially dental schools now. These dental schools, they just want to add on PowerPoints, but not necessarily clinic chairs. So are you really ready to work in patient's mouth yet? Many dental students say yes. Then you go to residency and you find out how much you didn't know. So that's something to be in mind. Who said what watch you have on? The watch I got on tonight is this is a Citizen Grand Touring Sport. It's an automatic Citizen. Actually, check out the back of it. I love this one. My parents got me this for my... See, it's got the open case back. That's the back of it. My parents got me this for my 20th birthday. 9 years ago. Hangry Hedgehog said, do you guys think Amulya is doing her homework? Harris said, I'm at SBU Dental, and this is not easy. Yeah, it's definitely not. That's where I was. I was at Stony Brook Dental, and it's definitely not easy. It takes a lot of work, a lot of time. Here's another thing. During dental school, I still worked. I worked Sunday mornings. And that time, rather than sleeping in, it would give me, it's like $80 a week. I would work one day for 5 hours. It was like 60 to $80, but it would block out some time that I could use to study and kind of like get my week ready. So Sunday has become my like week prep day, like big time. And so Sunday mornings do that. That's where I saw my mentors. So whenever I was really stressed out in dental school, I could go and talk to them while they were doing their workout, and they would always give me good answers and guidance. And last but not least, I got a free gym membership to doing that. So that was pretty good. That was really good. Chelsea, dental assistant here. What's your opinion on silver diamine fluoride for peds patients the doctor worked for refuses it? That's pretty good for arresting caries, but I don't know enough about it because I don't do anything with cavities anymore. I haven't in 4 years, if you really think about it, right? I haven't touched cavity stuff since dental school, so I wouldn't be the best person to ask for that. Rai B said, any tips for interviews and conversations? I am shy and not good at short talk / conversing. Well, one way to go about it is like practice it, really try and work on it. But another thing is, it's not the end of the world either. Smile, be yourself, and ask questions, and try to see what you could connect with the interviewer on, if that makes sense. All right, friends, time to wrap it up. It's about 10 o'clock. This is TikTok Live number 52, top 5 listeners that came on for the entire night. And thank you, guys, everyone that stayed on through it. I'm going to be giving you guys a shout out, top 5. Sometimes I bump it down to 6, 7, or 8. But the top 5 listeners, I'll be giving you guys a shout out in the caption on YouTube, on Spotify, on Apple Music podcasts. And thanks for coming on, guys. Number 52. We're past the halfway point, fam. All right, guys. Wish you a good night. Have a great week. Thanks for coming on. It's Monday. I'll see you guys next weekend. All right, let's do it. All right.